Hello everyone, myself Dr. Arya, a working gynecologist. Today we are going to talk about Polycystic Ovarian Syndrome. Do you know PCOS affect 1 in 10 women of reproductive age group? Yes, yet it remains the most misunderstood endocrine disorder. Today we are going to make a series on PCOS which will make you understand what is PCOS, how can you diagnose it, what are the effective ways to control the PCOS, evidence-based management for the diet, exercise, lifestyle modification, and if you don't take care of this condition seriously, what are the complications you will land up in future. Let's dig in. PCOS is diagnosed by Rotterdam criteria, which contains three elements. First, ovulatory dysfunction. Second, hirsutism or androgen excess. Third is ultrasound evidence of polycystic ovarian morphology. Two among these three criteria is sufficient enough to consider the diagnosis of PCOS in a woman. First and foremost, what is ovulatory dysfunction? Ovulation is the process of release of ovum from the ovary which occur cyclically in a particular interval in a healthy female in her reproductive age group. We can diagnose ovulatory dysfunction with the irregular cycles experienced by the woman. Irregular cycles are normal within the first year of menarche. Menarche is the process of first menstruation experienced by a woman. After 1 year of menarche, within 3 years, if a woman is experiencing menstrual cycle in a frequency less than 21 days or more than 45 days, can be considered as an irregular menstrual cycle. When a woman attained menarche 3 years back and now also she is bleeding with a frequency less than 3 weeks or is more than 35 days, or she is having menstruation only less than 8 times a year, can also be considered as an abnormal menstruation or irregular cycle. Woman attained menarche 1 year back and now also she is experiencing amenorrhea for more than 90 days, can also be considered as irregular cycle. The second criteria we discussed was hyperandrogenism. Androgens are hormones produced in our body. They are the basically male hormones, but these hormones are also present in females. When the androgen levels are more than which is expected in a female body, it can cause an ovulation, it can lead to PCOS. How we will diagnose that my androgen is excess in amount? Definitely the unwanted hair growth in our upper lip, chin, chest, breast, abdomen, thighs, and the hair loss which is happening and the acne we are having. These are indirect evidence of androgen excess in our body. Our third point is PCOM morphology in ultrasound. Name PCOS is a misnomer. There is no cyst in the ovary. These are the unovulated follicles which is remaining in our ovary. So these are the criteria, these are the signs which are shown by a person who is suffering from this disease. And PCOS is not something only affects ovaries. It is a multifactorial, multi-systemic disease. So the whole point is only an ultrasound report of PCOM morphology can't label you PCOS syndrome, because the 2 out of the 3 criteria that we discussed earlier is necessary for making the diagnosis, and an ultrasound report is not even necessary for making the diagnosis of PCOM. And the most important part is, for an adolescent woman, there is no need for doing ultrasound because the ovary takes around 1 to 8 years for the proper reproductive maturity. If you are not having any signs or symptoms of PCOS, there is no need for an unnecessary ultrasound and unnecessary panic. Thank you. Thank you so much for listening to me. Bye bye.